Today, we are talking about understanding Parkinson's disease. All right. So this is a condition that I'm sure a lot of us have maybe know someone, or maybe we, have it. I know I have had friends that have Parkinson's disease. I've worked with a number of people and exercise that have Parkinson's disease, and used to regularly actually participate in a Parkinson's support group to kind of share how exercise can help. But we're going to talk about the whole condition and what it is, the symptoms, and at the end we'll have some time for discussion and anything that you want to share. So one of the reasons we are talking about this is April is actually Parkinson's Awareness Month, put on by the Parkinson's Foundation, which has a lot of valuable resources for people with Parkinson's. And so I thought it was a good time to discuss it. One moment here. All right. So I know there's a lot of words. This should be the wordiest slide, but this is what is Parkinson's disease? So it's a progressive neurodegenerative disorder that affects predominantly dopamine-producing neurons in the brain, leading to movement dysfunction. And so it's a very specific part of the brain, which we'll talk about. But that effect will affect movement, among other things, causes a number of symptoms. It affects almost 1 million people in the United States and more than 6 million people worldwide. Currently, all therapies used in Parkinson's disease improve symptoms without slowing or halting the disease progression. So it is progressive in nature, and there's no known cure yet, but there are a myriad of treatments and ways that we can kind of slow or at least minimize the symptoms of the progression. We can't really slow it or halt the progression, but at least minimize symptoms. And these symptoms, as I said, generally progress slowly. So it's possible to have a great quality of life when you work with a movement disorder specialist, you exercise regularly, and you have a good support group. Really kind of taking stock of what's in your life. You can definitely live with Parkinson's with a great quality life. So what exactly happens? What causes Parkinson's? A specific part of the brain called the substantia nigra, which is in your basal ganglia, which is essentially the midbrain, so right in the middle of the brain. The neurons there are affected and in that substantia nigra, and these are neurons that produce dopamine, which is a neurotransmitter. Basically, it sends information around the brain, and when dopamine isn't produced as readily, then there's just a lot of gateways and such in the brain that are closed, and it causes executive function in the brain to be much slower. Executive function being specifically your ability to do something. If you decide, I want to stand up, if you have Parkinson's, because of that low level of dopamine, it may actually be hard to initiate that movement. So a lot of times there's freezing and slowness of movement. So loss of the neurons in the substantia nigra leads to the reduction of dopamine, which causes the symptoms of Parkinson's disease, which we're going to go into. And just you have some information on a little diagram of the brain. But the substantia nigra is right here. It's right kind of in the middle lower part. This midsection, I don't know if you can see my mouse, but that red area is the basal ganglia, which is in the midbrain. And the basal ganglia can almost be thought of as the command center of the brain, or the gatekeeper of the brain, because you get signals coming up from your feet, the rest of the body that go up to the basal ganglia, and then you have signals from your cortex in your, what you're thinking, what you want to do, and both of those have to go through the basal ganglia in order to do something, in order to have an action. So when dopamine isn't produced, which is one of the large communicators of all these parts of the brain, then you start having slowness of movement. It's hard to create an action. Just to show kind of what this looks like. So in the substantia nigra, you have Oh yeah, and if you in the substantia nigra, you over time, a healthy substantia nigra has the very well formed neurons there that produce your dopamine. In Parkinson's, those neurons start to get damaged and start to die, and so they produce a lot less dopamine, and then therefore less signaling in the brain. So it just kind of shows the difference between a healthy brain and someone who has Parkinson's, especially in later stages. And so symptoms, most of the time, that's what we think of when we think of Parkinson's. And in fact, even though we know of these things that go on in the brain, it's actually really hard to diagnose Parkinson's just by looking at a brain scan. You can't just look at, it's really hard to look specifically at like the substantia nigra and see that. Typically, you'll see this, on someone after they've passed away, but you can't really see it in someone that's alive. There's no way of really diagnosing specifically looking at the brain. So often a doctor will look at the symptoms, and often the motor symptoms are the most obvious. That's why we have this little iceberg here. The symptoms of Parkinson's, like tremor, rigidity, akinesia, postural issues, those are all things that we see, but there's also things that a lot of people don't see that we're going to talk about, a lot of the non-motor symptoms. So motor symptoms, a common acronym that is used and that a lot of specialists will look for is called TRAP. So the tremor, often affecting one side, could affect both, but often at least one side of the body. Rigidity in the body, so muscles being tight and hard to move in range of motion. Akinesia and bradykinesia. Akinesia is either no movement or it's hard to initiate movement. Bradykinesia means a slowness of movement. And then postural and balance issues. So often Parkinson's disease leads to kyphosis, so that kind of hunched posture, and balance is often affected. Other areas, other motor symptoms, festination, which is kind of like the short shuffling steps that might be seen when somebody tries to walk that has Parkinson's. Freezing, and that's where someone, if they want to do something and then they just freeze. They kind of can't move anymore. Maybe they're walking and somebody says, "Oh, turn around," or pick this up. And when they try to initiate that motion to pick something up, they kind of freeze. And then also the masked face. This is where the muscles in the face kind of end up getting more rigid and stiff, and so it's hard to smile, hard to show expression. So it's almost like wearing a mask. And I will say, my grandfather actually has Parkinson's, and that's one of the things that and unfortunately he's a later stage right now. So it's hard for him to express anything facially, and over time, just as it progresses, it's just hard to move in general. It's kind of they get stuck within their body, at least in motor symptoms. For non-motor symptoms, there's a whole variety of things that can happen. Some of the more common ones would be like a loss of taste or smell, having issues with sleep, constipation and depression are all very common non-motor symptoms. Other things could be early satiety, so like getting full more quickly, which often can lead to weight loss. There can be vision problems, other mood disorders like anxiety or irritability. Orthostatic hypotension, so like when you stand up or get up quickly, kind of getting lightheaded is another one. So there's a lot of symptoms that also happen. So I mean, often specialists and we focus on the motor symptoms because that's a big one that's obvious, but many other things can be affected. And in later stages, because this is a disease, within the brain that's being affected, later stages can also lead to dementia, Parkinson's-induced dementia, and Lewy body dementia. As for causes, it's not really fully understood what causes Parkinson's disease, but it's theorized that it's a combination of both genetic and environmental factors. Some of the main risk factors are age. So about 1% of all people over 60 have Parkinson's disease. So it's a pretty high percentage. And for gender, Parkinson's disease is 1.5 times more common in men than it is women. And it's not really known why that's the case. For age, it's a little more understood because with age, naturally, neurons in the brain can die. And in fact, a lot of people that may not have diagnosed Parkinson's disease may have Parkinsonian traits, or what's sometimes just known as Parkinsonism. It's not really the actual disease, but it's just because of a number of neurons in the substantia nigra have just died naturally, that there is less dopamine and therefore kind of similar traits. You might have a tremor, not have Parkinson's, for instance, or rigidity and postural issues tend to increase as we get older, but that doesn't necessarily mean you have Parkinson's. Some other causes, environmental exposure. We're going to talk more specifically about that, and then genetics, which we'll talk a little bit about as well. So environmental risk factors, this is one of the things that actually is probably most related to Parkinson's, especially lately. A lot of research has been coming out on it. Long-term exposure to metals, like certain metals that like you're inhaling, like microscopically, solvents and polychlorinated biethylens, or PCBs. So when you're working in like industrial type jobs and other just jobs where you're dealing with chemicals for a long-term exposure and such, that can lead to Parkinson's. There's also been a strong link between Parkinson's and the exposure to pesticides or herbicides. And one specifically called paraquat. It's a widely used commercial herbicide in the US. And it's actually banned in 32 countries, but the US unfortunately still hasn't banned this herbicide, but it's strongly linked with Parkinson's disease. So there has been a push from like Parkinson's Foundation and such to ban this, like so many other countries have, but so far it hasn't. And there's also been many studies that have shown like near farming type areas where a lot of herbicides are used, there's a much higher percentage of people that come down with Parkinson's. But a lot of times it's just that long-term exposure. So it's when one instance of being exposed to it may not lead to Parkinson's, but when you have constant exposure to these chemicals, that's when you're at higher risk of developing Parkinson's disease. And that may also be why men are more likely to develop it than women, because oftentimes it's men that are working in these kinds of industries that they're exposed to such chemicals. But that's just conjecture. It's not exactly well known yet. And finally, another environmental issue would be head injury. So a famous person that developed Parkinson's would be Muhammad Ali. He was a boxer, and when you have chronic head injuries, that can actually cause significant damage to that part of the brain, the substantia nigra, and lead to at least very similar traits to Parkinson's disease. As for genetics, Parkinson's isn't really considered a genetically inherited disease, but there are certain genes that are associated with it, certain gene mutations specifically. And so genetics can cause about 10 to 15% of Parkinson's. But it is likely the interaction of genetics and environmental factors. So if you have some of the genes that might predispose you to Parkinson's, and then you kind of are exposed to some of these environmental things, that's when Parkinson's is higher risk. Just because you have a gene for Parkinson's doesn't mean that you're going to develop it. And in fact, there's a pretty low likelihood you do. So those were just some of the risk factors. Now, there are some possible, and these are very potential protective factors. And I'm kind of in order of, there's been a number of studies for each of these categories, but still none of it's been absolutely confirmed. So number one is exercise. So if you exercised a lot, in your younger years and are still consistently exercising, that generally will have a protective effect from developing Parkinson's. Although it probably also depends on what you're doing. If you are a boxer or a football player, for instance, that may be counterintuitive, but regular exercise is generally protective. Caffeine actually has been shown to have a strong link. So drinking coffee or tea actually has a potential protective effect. getting enough vitamin D. There's been a strong correlation with people that have a high level of vitamin D in their system, regularly, generally are less likely to develop Parkinson's. Regular anti-inflammatory drug use, so like taking an ibuprofen or like aspirin or something daily has been shown to be correlated protecting against Parkinson's. Now, these last two are a little more interesting. Uric acid or urate. This is a chemical commonly found in your blood, but largely from meats, like red meats. It's been found to have a protective effect only in men primarily, and it's not really understood why this could be the case. But for whatever reason, a higher percentage of uric acid in the blood, like from consumption of a lot of meat generally, has protective effect in men. And there's also been an interesting effect on smoking, actually has a potential protective effect. Now, obviously, there's so many negative things with smoking. It's highly not recommended to do that to protect against Parkinson's. They actually think that the reason why there might be this correlation is that that generally people that smoke regularly, are addicted to smoking, and that has a lot to do with the dopamine in the brain. Addiction, causes these big bouts of dopamine stimulus, and so if you're addicted to smoking, most likely there's not really like that strong of you're not going to have a lowered dopamine rate in your brain. People actually, it's often like people with Parkinson's, if they were smokers, have an easier time quitting smoking because they don't have that dopamine rush that is causing them to want to smoke. So there's some interesting correlations there, but it's not recommended to start smoking. It's just an interesting observation that smokers, regular smokers, generally have a less likelihood of developing Parkinson's, but they have a greater likelihood of developing other conditions. So don't start smoking. For diagnosis. There is no specific Parkinson's test that can run for diagnosis. Like there's no easy way to perfectly diagnose Parkinson's. It's generally diagnosed through a combination of symptom analysis. So kind of think of those motor symptoms we talked about earlier, the trap, for instance, and neurological and physical examination. So some of the neurological tests would be like imaging tests like MRI, CT scan, ultrasound, or PET scan. And these can help rule out other neurological conditions, disorders, but not specifically diagnose Parkinson's. And that's one of the tricky things in diagnosing Parkinson's, is that there's so many other neurological conditions, and they often overlap in terms of what their symptoms are, that it's hard to specifically find which, if you have Parkinson's or something else. But a combination of these tests, you can normally get pretty close. The other thing with Parkinson's is it's very diverse in how it manifests within people. Some people have early, for most people it's over age of 60, but some, it can be seen in the 40s and earlier. There's sometimes early onset. Everyone's a little bit different, and so it does often involve extensive testing, and often symptoms have to be pretty apparent before it's diagnosed. Once it is diagnosed, there's a variety of medical treatment, and everyone's different. Again, it's going to be dependent on how bad symptoms are, and medical treatment is largely to treat just the symptoms. Again, there's no way to really halt or slow progression of Parkinson's, but you can manage symptoms with medication. So carbidopa and levodopa are some of the more common medications. Levodopa specifically is the one that is used. That what it does is a lot. Actually, I wrote it down here. So levodopa is a chemical that can pass into the brain and convert into dopamine. So because Parkinson's causes dopamine to be deficient within the brain, which then causes all those motor symptoms, levodopa can can produce more dopamine in the brain. And when combined with carbidopa, this offers protection from early conversion outside the brain. So the goal, dopamine can affect other parts of the body too, not just the brain. And so the goal is you want a boost of dopamine within the brain in order to mitigate those effects from Parkinson's. And so often levodopa and carbidopa are used in conjunction together. The only problem with this basic treatment is that long-term use, generally it becomes less effective over time. So it's not, unfortunately, the body kind of gets used to this chemical and you get less bang for your buck over time. And so then there's other stuff like dopamine agonists, and some of the common ones are ropeneol and pramipexole, which I didn't write here, but I have written here. And these therapeutics work to mimic dopamine's mechanism of action. And so rather than converting into real dopamine, they kind of trick the brain into thinking it has dopamine, and that actually can minimize your symptoms. And the benefit of dopamine agonists is just that they don't tend to lose their effectiveness as much as the levodopa over time, but they aren't really as effective because they're not producing real dopamine. So often, as the disease progresses, it can be a combination of these two medications. Also, depending on the situation, deep brain stimulation is a common procedure that can be done, in which they actually put a little electrode kind of in the brain that stimulates that substantia nigra and therefore the communication to your motor centers. And this can be really, really beneficial, especially for younger people with early onset Parkinson's. And then finally, physical and occupational therapy are often prescribed to address movement issues like balance issues and postural issues to help kind of mitigate those. So finally, what to do if you have Parkinson's. So if you or someone who has Parkinson's, these are actually 3 things that I learned when I regularly attended a Parkinson's support group. These are kind of 3 number 1 things that should be done. So number 1, if you have Parkinson's, is you want to find a movement disorder specialist. And this is a neurologist with additional training in Parkinson's and other movement disorders. So not necessarily, you don't want just any neurologist. Like neurologists work on many different things. Generally, you want somebody who, who is specifically a movement disorder specialist. Number 2, you make sure you get out and don't isolate. It's very common when you have Parkinson's to want to just kind of hole up and stay in your room. And, often your desire to like socialize is down. Dopamine is something that kind of stimulates the reward centers in the brain. So it makes you feel good when you talk with people. When you have less dopamine, which Parkinson's produces, it's, you don't feel like you typically don't want to socialize and do things, but it's important to get out and not to isolate. Try to get out and do things. And finally, number 3, exercise. Super, super important. Exercise as much as you can. Have a variety of exercises. You can join groups specific for it, or just make sure you're doing something. Be walking, strength training. Really, the more diverse, the more type of exercise you do, the better. So those are the 3 things. I would also add just number 4. It kind of goes in conjunction with the don't isolate. It's really important to have a support group of some kind. So make sure, you have a team. You have, not only your doctor, but your family behind you to help motivate, because that can be a number 1 way of really staying on top and making the most of it. Because Parkinson's, while it is a scary thing to have, it's not, it is very slow and progressing, and it's something that you can live with very well.